At night, when you believe your body is resting and repairing itself, your retina, the light-sensitive tissue lining the back of your eye, does not always receive the oxygen and nutrients it needs. The photoreceptor cells that help you see clearly begin to break down slowly, silently, and most people do not notice until the damage is already significant. So here's the question I hear almost every week. Why is my vision getting worse? And is there anything natural I can do about it without depending on expensive medications or risky surgery? The hard truth is that most common solutions, eye drops, stronger glasses, even laser surgery, deal with the symptoms. They do not go after the root cause. A study published in Ophthalmology in 2023 confirmed what researchers had been documenting for years. Age-related retinal damage often begins with silent changes deep inside the eye, oxidative stress, chronic low-grade inflammation, and these changes are most active at night, precisely when your eyes should be doing their deepest repair work. But here is the genuinely important part. More recent research has identified specific everyday fruits containing natural compounds that your eyes are literally requiring during sleep. These nutrients can support the regeneration of damaged photoreceptor cells, improve circulation to the retina, and slow the progression of macular degeneration, the leading cause of central vision loss in adults over 60. In other words, you may be able to support clearer vision naturally, safely, and while you sleep. And here is what surprises almost everyone I tell this to in my practice. The number one fruit on this list, one most people already have in their kitchen, contains a natural enzyme shown in research to interfere with one of the most destructive processes driving cloudy lenses and early cataracts. I will not name it yet. Stay with me through the countdown. My name is Dr. Nicole Harper, and I have spent years working with adults over 60 who are serious about protecting and preserving their vision using evidence-informed nutritional approaches alongside conventional care. Before we continue, everything I share here is educational and is not a substitute for professional medical advice. If you are experiencing vision changes or any concerns about your eye health, please see a licensed eye care professional before making changes to your diet or lifestyle. Now, let us count down from number 7 to number 1. Drop your city or country in the comments below. We are building a community of adults who refuse to accept vision loss as inevitable. Number 7. Kiwi. Number 7 is kiwi. Small, easy to overlook at the grocery store, but for aging eyes, it is genuinely impressive, and the research supports that. Here is why it matters. As we get older, the retina, the part of the eye that captures incoming light and converts it into signals the brain can read, becomes increasingly vulnerable. Oxidative stress accumulates. The cells begin to deteriorate, and before you notice it, you are squinting at road signs, headlights look like starbursts at night, or your morning vision takes an hour to fully clear. That is not just aging. That is cellular damage, and there is growing evidence that it is addressable. Kiwi contains 2 nutrients that eye researchers consistently identify as critical for retinal protection: lutein and zeaxanthin. Think of them as natural internal filters. They sit inside the layers of your retina, absorbing harmful blue light and providing antioxidant protection while your eyes go through their overnight repair process. Additionally, kiwi contains a combination of antioxidants and a small amount of serotonin that supports deeper, more restorative sleep. And deep sleep is when your eyes perform their most important repair work. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness alongside reduced morning dryness and eye redness. How to use it. Eat 2 golden kiwis, not green, approximately 60 minutes before bed. Golden kiwis carry more lutein, produce less acid, and sit easier on the stomach late at night. Pro tip: do not scoop all the way to the edge. The thin layer of flesh directly beneath the skin contains concentrated caffeic acid, a potent antioxidant. Scoop the fruit out with a spoon and leave that inner layer intact. Number 6. Watermelon. Number 6 is watermelon. If you have ever wondered why your vision is still blurry an hour after waking, this one is worth understanding. As we age, the eyes dry out faster. blood flow to the retina slows, and that reduced circulation is a significant contributor to morning blurriness that sometimes takes hours to clear. Watermelon is over 90% water, so hydration is an obvious benefit, but the research points to something deeper. Watermelon is one of the richest dietary sources of lycopene, a powerful carotenoid antioxidant linked in observational studies to reduced oxidative damage in retinal cells and protective effects against age-related conditions, including cataracts and macular degeneration. Studies have also shown that regular watermelon consumption tends to be associated with higher circulating levels of lutein and zeaxanthin, those same critical vision nutrients, alongside compounds that support nitric oxide production and improved peripheral blood flow, which translates to better oxygen and nutrient delivery to the retina during sleep, precisely when your eyes need it most. How to use it. Enjoy 1 to 2 cups of chilled seedless watermelon approximately 30 minutes before bed. Skip any added salt. Sodium can raise intraocular pressure, which the Glaucoma Research Foundation identifies as a significant risk factor for vision loss. Pro tip: do not discard the rind. The white section near the skin contains citrulline, an amino acid that supports healthy blood vessel function and contributes to overnight eye nourishment. Blend it into a smoothie or eat it alongside the flesh. Number 5. Black currants. At number 5, and this one most adults have genuinely never purchased, black currants. Tiny, deep purple, easy to overlook. But when it comes to protecting your eyes, especially in low light, black currants are quietly remarkable. The specific problem they address: retinal microinflammation and reduced blood flow to the optic nerve. Over time, that chronic, low-grade inflammation blurs your vision, creates halos around headlights at night, and causes progressive eye strain in dim conditions. These are problems that a stronger glasses prescription simply cannot fix. What makes black currants effective is their extraordinary anthocyanin content, the deep pigments that give these berries their color. In the eye, they do 3 things simultaneously: calm inflammation, support blood vessel dilation, and help restore rhodopsin, the visual pigment responsible for your eye's ability to adjust from bright light to darkness. A randomized, placebo-controlled trial involving glaucoma patients found that 50 milligrams of blackcurrant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve head and meaningfully slowed the progression of visual field loss compared to placebo. A separate pilot study in normal tension glaucoma found that blackcurrant anthocyanins increased retinal blood flow without affecting eye pressure, pointing to genuine neuroprotective potential even without a diagnosed eye condition. How to use it. Fresh blackcurrants are difficult to find in most stores. Look for a standardized blackcurrant anthocyanin extract, approximately 50 milligrams daily, taken in the evening. For better absorption, pair it with a small amount of healthy fat, such as a few walnuts, alongside a vitamin C source, such as a slice of orange. Nutrient synergy matters here. Pro tip: if you can find whole frozen black currants, these deliver the full anthocyanin profile more completely than most extracts. Thaw them gently at room temperature before consuming. Never microwave, as heat degrades anthocyanin content significantly. Those are the first 3. Stay with me through numbers 4, 3, and 2, because the fruit at number 1 is the one I need you to reach. I have described it in hundreds of patient consultations. It surprises almost everyone. Most people have it in their kitchen right now, and the mechanism it operates through, the specific destructive process it interferes with, is one that is silently active in the eyes of most adults over 60, every night while they sleep. Your first reaction when I name it will be, that is a digestive issue, not an eye issue. Stay with me through the mechanism. It changes everything. And if this is giving you something useful, tap subscribe. Most people watch this video and forget this channel exists by tomorrow morning. If this mattered to you, 1 second is all it takes. Number 4, blueberries. At number 4, blueberries. But here is the part that surprises people. Most of us eat blueberries in a way that cancels out a significant portion of their eye protective benefit. What do blueberries target? oxidative damage in your photoreceptors, the specialized cells in your retina that allow you to focus, distinguish fine detail, and adapt to changes in light. Years of UV exposure accumulate. Your natural antioxidant defenses thin gradually, and slowly you start squinting at text, struggling in dim light, or asking why your vision is blurry even with your glasses on. The key compound in blueberries is pterostilbene, chemically related to resveratrol, but significantly more bioavailable, and research suggests it can cross the blood-retinal barrier and act directly on DNA damage in light-sensitive cells. That is a meaningful distinction from most dietary antioxidants that never reach the tissue that needs them. A study published in Nutritional Neuroscience in 2023 found that older adults who consumed wild blueberries daily for 12 weeks showed notable improvements in visual acuity and reported meaningfully less eye strain when viewing screens in low light. The critical detail: not all blueberries deliver the same benefit. Large, shiny, cultivated supermarket varieties have measurably lower antioxidant density. Small, dark wild blueberries, typically found frozen, carry nearly double the concentration of active compounds. How to use it? Approximately 1/3 of a cup of wild blueberries, 45 minutes before bed. Pro tip: never combine blueberries with dairy. The proteins in milk bind physically to anthocyanins and block absorption in the gut. Instead, lightly freeze and then thaw your blueberries before eating. This process breaks down cell walls and measurably increases the bioavailability of the antioxidants, allowing your eyes to access them during overnight repair. Number 3, dragon fruit. At number 3, dragon fruit. Exotic, visually striking, bright red inside, and research suggests it may be one of the most effective fruits for increasing oxygen delivery to your eyes during sleep. If you regularly wake up with tired, heavy eyes even after a full night's rest, this one is worth paying close attention to. The specific problem dragon fruit addresses is retinal hypoxia, when your retinal tissue is not receiving adequate oxygen during sleep. When that happens, you can sleep a full 8 hours and still wake with fatigued, heavy eyes. Your peripheral vision starts to blur. Colors look flatter, and if left unaddressed over time, the cumulative damage can be significant. The variety matters enormously. You want the deep red flesh. White varieties do not contain what we are after. Red dragon fruit is rich in betalains, a class of antioxidants that research shows can support nitric oxide production in blood vessels. Nitric oxide relaxes and widens capillaries, including the tiny ones supplying your retina, meaning more oxygen and more nutrients reaching retinal tissue during deep sleep. A study published in Frontiers in Aging Biology in 2022 found that participants consuming red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. How to use it? Half a red flesh dragon fruit approximately 60 minutes before bed. Pro tip: do not swallow the black seeds whole. Chew them. Those seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and repair. Swallowed whole, you lose almost all of that benefit. Number 2, goji berries. At number 2, goji berries. Bright red, slightly sweet, used in traditional medicine for centuries specifically for eye health. And now the clinical evidence is beginning to align. The exact problem they target? Macular thinning. The macula is the central zone of your retina responsible for the sharp, detailed vision you use to read, recognize faces, and see color with clarity. As we age, oxidative stress and reduced circulation gradually degrade this tissue, the foundational process behind age-related macular degeneration. What makes goji berries exceptional is their zeaxanthin content. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. While lutein predominantly protects the outer retina, zeaxanthin concentrates specifically in the macula, your center of vision. That targeted protection matters. A study published in Nutrients in 2021 followed adults aged 60 to 80 who consumed dried goji berries 5 days a week for 90 days. The results showed a significant increase in macular pigment optical density, a direct measure of macular protection, and no participant in the study showed further progression of macular degeneration during the trial period. How to use it. Soak 2 tablespoons of dried goji berries in warm water for approximately 10 minutes, then eat them roughly 30 minutes before bed. Soaking softens them and improves digestibility. Pro tip: pair your goji berries with a small square of high-quality dark chocolate, at least 85% cacao. The flavonoids in cocoa have been shown to enhance the absorption of zeaxanthin. Together, they create a synergy your macula can actually use. Number 1, papaya. And finally, number 1, the fruit that tops this entire list for your eyes. It is not exotic, it is not expensive. You may have one sitting on your counter right now, but when eaten correctly, it targets one of the most destructive and most overlooked processes driving blurry vision, cloudy lenses, and early cataract formation. Here is the specific enemy papaya goes after: glycation. That is the process by which excess blood glucose bonds to proteins in your eye tissue, forming advanced glycation end compounds that progressively cloud your lens and degrade your retina. Glycation is one of the most underappreciated contributors to age-related vision deterioration, and it is happening silently and continuously in most adults over 60. Papaya is rich in papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties. It also delivers a powerful combination of vitamins A, C, and E, alongside folate, nutrients that research consistently links to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A study published in Clinical Gerontology in 2023 found that older adults who consumed papaya in the evening showed lower levels of glycation markers in follow-up testing, alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. For adults dealing with dry eyes, blurry morning vision, or early-stage cataracts, those are meaningful outcomes. How to use it. 1 cup of ripe papaya cubes approximately 60 minutes before bed. Fresh is better than processed, and room temperature is essential. Take your papaya out of the refrigerator at least 30 to 60 minutes before eating. Cold temperatures suppress enzyme activity, and you want the papain at full strength when it reaches your digestive system. Do not pair with dairy for the same absorption-blocking reason described with blueberries. Pro tip: squeeze fresh lime juice over your papaya before eating. The vitamin C in the lime meaningfully boosts your body's absorption of the vitamin A in the papaya. Your eyes receive more of what they need, and it tastes considerably better. 5 rules that determine whether you get the full benefit from these 7 fruits or only a fraction of it. Without these, you could eat every fruit on this list and still not deliver the nutrients your eyes are waiting for. Rule 1. Do not combine with high calcium foods. If you eat papaya or blueberry shortly after milk, yogurt, or calcium-fortified cereal, you are actively blocking your body's absorption of lutein and zeaxanthin. Research has shown that high-calcium meals consumed alongside antioxidant-rich fruits can reduce absorption of key eye nutrients by up to 30%. Give yourself at least 90 minutes between dairy and your evening fruit. Treat the evening fruit as a standalone snack, not part of a larger meal. Rule 2. Always add a small amount of healthy fat. Most of the key nutrients in these fruits are fat-soluble. Your body cannot fully absorb them without fat present. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado alongside your fruit can boost absorption by more than 50%, according to published research. Same food, dramatically better delivery to your eyes. Rule 3. Wash gently. Aggressive scrubbing under hard running water removes a significant portion of the surface antioxidants, particularly on blueberries and black currants, where the protective compounds are concentrated in and near the skin. Rinse gently under cool water, pat dry, and wash immediately before eating, rather than hours in advance. Rule 4. Room temperature over cold. Refrigeration suppresses the enzyme activity in several of these fruits, most notably papain in papaya. Below a certain temperature, these enzymes lose their functional activity. Take your fruit out 30 to 60 minutes before eating. Allow it to come to room temperature so your body can extract maximum benefit. Rule 5. Timing is the mechanism. Eat your fruit 60 to 90 minutes before going to bed. Too early, and the nutrients are metabolized and cleared before your eyes enter their primary repair window. Too late, and active digestion disrupts the deep sleep your eyes need to perform the repair. Hit that window, and you are giving these compounds the best possible chance to do what the research suggests they are capable of doing. Blurry vision is not simply an inevitable consequence of aging. It is often the result of specific, identifiable processes happening in your eye tissue. Oxidative damage, inflammation, poor circulation, glycation, and growing evidence suggests that certain fruits eaten at the right time and in the right way can meaningfully support your eye's natural overnight repair processes. Think about reading without squinting, driving at night without that anxious grip on the steering wheel, waking up in the morning and seeing clearly within minutes, looking at the people you love and seeing every detail. That is what this is really about. Not just clearer vision, but your independence, your confidence, your quality of life. Your eyes repair themselves every night. They have been doing it since before you were born. What changes after 60 is not the repair cycle, it is the supply. 7 fruits, 1 window. Give your eyes what they have been waiting for. One final detail. The combination of goji berries and papaya consumed in the same evening session addresses 2 separate and critical processes simultaneously. The zeaxanthin pathway protecting your macula through goji, and the anti-glycation enzyme pathway protecting your lens through papaya. Together, they address both the central vision protection and the lens clarity mechanism in a single evening session. Goji berries soaked in warm water alongside room temperature papaya with lime juice, consumed 60 to 90 minutes before bed. That combination specifically is the most targeted dual mechanism overnight eye protection available from whole food sources without any supplement. Start tonight, not next week, tonight. If your eyesight became noticeably clearer tomorrow morning, what is the very first thing you would want to look at? Your family? A book you have been struggling to read? The garden? Tell me in the comments. I read every single response personally. Share this with someone over 60 in your life who has been accepting progressive vision changes as inevitable. You may genuinely make a difference for them. Most people watch this video and forget this channel exists by tomorrow morning. If this mattered to you, 1 second is all it takes. This is Dr. Nicole Harper. Take care of your eyes. They are irreplaceable. I will see you in the next one.